Welcome, welcome, welcome. This is the first for UCSF NET support group, and we are delighted to join the NorCal CarciNET UCSF support group this May 6th for the first time, as I said, for the UCSF participants to do it by Zoom. I understand NorCal CarciNET are old pros at the meeting, so we appreciate Josh's support and guidance. In any event, we're delighted to be here today. We're presenting a panel, and the panel is a multidisciplinary team of healthcare professionals that provide monthly NET wellness clinic. The clinic occurs in Mission Bay at UCSF, and the panelists are the members of the NET Wellness Clinic. So it's actually like you're coming to clinic with us today, and we invite you to see what we offer. We're thrilled to be here. Pass the baton over to Angela Laffin, who's a nurse practitioner and whose clinic is really the brainchild of Angela. So Angela, can you start?
I will, Lacey. Can everyone hear me okay?
Yep.
So I'm a nurse practitioner, as Lacey said, and I'm sure that I have met many of you on this call today. I work in the Neuroendocrine Wellness Clinic, Neuroendocrine Clinic at UCSF with Dr. Bergsland and other members of that team. And it was about 2 years ago that my colleague Sheila Lindsay and I came to this support group, and we came to gauge your interest in having what we were calling at the time a survivorship clinic for patients with metastatic neuroendocrine tumors. There's a lot of services and support available to people in the context of survivorship after they've finished treatment. But as many of you know, a lot of patients live with neuroendocrine tumors as a chronic illness. And I really felt that there was an unmet need for these patients. So we know that a healthy lifestyle is extremely important in preventing other illnesses. As people live with their neuroendocrine tumor, they are prone to getting other illnesses like cardiovascular disease or diabetes. We know that a healthy lifestyle is really important for improving people's quality of life. So we wanted to make sure that neuroendocrine patients had access to the resources that can help prevent these problems occurring, rather than you getting to meet us when a problem does occur. So it's about being sort of proactive rather than reactive in the way that we treat patients. So in order to address these unmet needs, we developed the Neuroendocrine Wellness Clinic. And we used the term wellness because during the support group, overwhelmingly, patients said they did not identify with the term survivorship, and they felt somewhat uncomfortable with the use of that, calling themselves a cancer survivor. Even though we know that a cancer survivor, the definition is from the time you're diagnosed until the end of life. But that is why we called it the Neuroendocrine Wellness Clinic, based on your feedback. The other part of the feedback that we received was that patients would prefer to meet with all of the providers on one day so that it would minimize multiple trips coming back and forth to UCSF campus. So that is how we structured it. I'm going to share with you a slide here, which I hope you can see. This is the way that the sort of flow of the clinic. So patients are selected as a candidate for the clinic. This is a clinic for patients with metastatic neuroendocrine tumors. They usually come from Dr. Bergsland's clinic, and it is just for UCSF patients at this time. The clinic is held once a month, And we send out a letter to patients and also a request for patients to do a food diary a week before they come to clinic. Then the patient comes to the clinic in the morning. We held it on a Tuesday. They're greeted and they're given a schedule of what the day will look like. And then they meet, as you can see from the little flow diagram, they meet with one of the providers every 30 minutes. So a social worker, nutritionist, exercise counselor, cancer resource specialist, and a nurse practitioner. So individually, we're going to talk about what we would do and how we would interact with you should you come to the clinic. From my perspective as a nurse practitioner, I give patients a summary of their diagnosis and the treatment that they've had. And I like to include the pathology report if that's available to me, because I've found that regardless of whether patients are newly diagnosed or whether they were diagnosed 12 years ago, often reviewing the pathology report will help them remember or provide them with new information that they may not have received in the past or may have forgotten. And then the rest of the time that I spend with patients, it's really open-ended, and I allow it time for discussion of anything from what are my other treatment options, side effects of treatment, reviewing prognostic factors, maybe talking about other issues regarding wellness, such as mindfulness meditation or sleep, as some people had questions about sleep. Anything that really the patient would like to discuss, I leave it open-ended for them. So that is really my role and sort of the foundation of why we developed the Neuroendocrine Wellness Clinic. We did do a, let me see if I have another slide here. No, I did do a poster that was presented at a survivorship conference in Australia, Melbourne, Australia in March, and it was looking at the feasibility and acceptability of this clinic. When patients leave the clinic, they fill out a brief survey for us, and we're asking them questions such as, did it meet your expectations? Would you recommend it to other patients? And overwhelmingly, patients said that it was a service that they really wish they had offered to them before, that it exceeded their expectations, and 100% of people said that they would recommend it to other patients that they know. So we got really good feedback on it. It's a clinic that is in evolution, so we're trying to listen to patients' feedback and to modify it in a way to make it more meaningful for patients. So with that, I think I will hand it over to Greta to speak about the nutritional aspects of the wellness clinic.
Sounds good. So hey everybody, I'm Greta and I'm the dietitian at the UCSF Net Wellness Clinic, and I'm just really excited to be here with you today to talk about the work that we're doing to promote wellness in our NET patients. So I just have a couple slides that I want to share with you to kind of guide you through. So let me see if I can get this up here. Let's see. That's not working. Hold on just a sec. Give me a minute.
Actually, it was working. You were able to get it.
Oh, I was working? Okay, great. Okay.
But you need to try it again. You took it down.
Did I take it down? Okay. Hold on, everybody. Let's see. Okay. So is it working now?
Yes.
I see it.
You do? Okay, great. So why is nutrition important for our NET patients? Well, we know, as Angela was saying, that nutrition and all of the components of a NET Wellness Clinic are important for improving functioning and quality of life for our patients. And we do that by promoting overall health and wellness, supporting the immune system, helping to manage side effects and complementing And overall, this leads to improved treatment tolerance and better overall survival. And so I just wanted to share with you 10 recommendations from the American Institute for Cancer Research and the World Cancer Research Fund about their cancer risk reduction recommendations. And they really focus around being at a healthy weight, being regularly physically active, and then eating more of a diet that's centered around whole foods that are plant-based and limiting consumption of added sugar, alcohol, and red meat. And you'll see that their last recommendation in the far right corner that I just circled in red recommends that after a cancer diagnosis, follow the recommendations, these same recommendations if you can. And so I just want to talk a little bit about what I might do in this context when a patient comes to our clinic. And really my number one goal is to help our patients develop nutrition goals, but this really means creating an individualized plan. So as Angela said, I'm going to take a look at a 3-day food record that a patient brings to clinic, and then talk more and find out a little bit more about individual food preferences, lifestyle factors, things like cooking and shopping habits, and then couple that with looking at things like medical and surgical history, weight history. If I have nutrition related labs, we'll look at those, and then medications and supplements that might be nutritionally relevant. And then talk with patients a little bit more about things like other nutrition symptoms that they might be having or their stool patterns. So from that, we can kind of take all that information and prioritize nutrition goals. And so if say we took a goal that 2 patients have the same goal, say it was to increase plant-based foods, is something that they wanted to work on to kind of focus on optimizing their wellness. It could look very different from patient 1 to patient 2. So one patient that may come to our clinic may have a non-functioning neuroendocrine tumor. They don't really have any gastrointestinal symptoms. And so that visit might really focus on looking at their food record and their lifestyle habits and looking at, say maybe right now they're eating 2 servings of vegetables a day and eating red meat 4 times a week. That focus of that visit might be really around realistically, what's a good goal that they could set themselves up for? Could they increase that to 4 servings of vegetables a day and maybe start reducing their red meat to 1 time a week, and really focus on what are some strategies that we could do? Is it incorporating 1 more meatless meal a week, getting more vegetable-based snacks in? What are some quick tips? So that would be one example of a patient. A second patient could come in and they might have that same goal of increasing plant-based foods. They might have had a previous bowel resection and be dealing with chronic diarrhea. And so that individual plan is going to look very different, because I might first want to work with the team on how we can medically improve their symptoms, look at their food record to see if there are certain foods that maybe are exacerbating their symptoms that we can look at. And then I'm going to want to dive deeper maybe into labs that can assess for nutrient absorption, what supplements they might need to ensure they don't develop deficiencies because of their GI symptoms. And then still come back to setting goals around how we can optimize wellness and up their intake of plant foods if that's their goal. And that might look different. It might look like adding in small amounts of, cooked vegetables or vegetable soups, things that they can tolerate better, or increasing their intake of whole grains that are high in soluble fiber, which are a lot easier to digest, like oatmeal or barley. So I just kind of wanted to use 2 examples just to show that it could look very different. But overall, we're working towards meeting people where they're at to work towards a nutrient-rich, whole foods diet, working towards following those AICR guidelines as they can, but really based on their individual needs. So some of the resources that I often give patients on our neuroendocrine.ucsf.edu website, I think we will be giving you that. I do have some nutrition links. And then I have some other websites that I recommend people to quite frequently that are listed on this slide. And then for cookbooks, I really like the Rebecca Katz cookbooks. Probably a lot of you are familiar with the cancer and I know everybody that's been to the Stanford meeting and even our meeting last year, our big neuroendocrine tumor meeting last year, got copies of some of the mini cancer culinary books that they were giving out. And then there is a book called Find Food You Love, which is specifically for patients with GI NETs and carcinoid syndrome. And there's a website, foodyoulovebook.com. And if that is the diagnosis that you have and you're looking for a specific cookbook, you can go on that website and see if they have free copies, any more free copies. So thank you so much. And I'm going to pass it on to Reagan.
Hi, everyone. I am Reagan Fedrick, and I work with UCSF. I've focused for the past 18 years on cancer and exercise development and programs. And so with the NET Wellness Clinic, I am available to do the one-on-one consultations. And, you know, my end goal is to, one, I always try to meet people where they are, just to get a sense of what you're currently doing or not doing, what you like to do, what you dislike, what you can or can't do, all of these things that come into the conversation. What you have access to, you know, are you working out at home? Are you, in past times, and hopefully we get there again, are you going to a gym? Are you taking classes? Are you working out in community centers? Are you looking for more of a rehabilitative, prehabilitative? Really trying to meet everyone where they are. And the end goal is always to keep it safe, do no harm, and to try to send you away with a plan that excites you. So I have I'm going to go to share screen. Let me see if I can pull this up. Just a couple of things. Let's see. I've worked for the past, couple of years with American College of Sports Medicine and a large group across this country and actually outside of this country on cancer and exercise development programs. And we ultimately are excited because last year, end of year, we had a big statement come out that, the new guidelines standard ultimately say that we hope we're all moving towards making exercise programming a part of the standard of care. In other words, that upon diagnosis or anywhere along the track of treatment, hopefully everyone in the world who is diagnosed with cancer will get information on exercise, be advised to exercise, and we'll continue to create and develop programs and create the resources needed to support cancer patients exercising, staying active. So I helped put together, this with a team of people, and ultimately these are the things I often say. If you've met with me, use it or lose it. I really do think that stop using the body and it starts shutting down in ways, right? It's just it's not as functional, not as flexible. You typically just don't feel as good. And another thing that I'll say is, anything is better than nothing. And I really mean that. If I move 5 or 10 minutes today, that's better than not moving at all. And so. I say this because obviously in the course of when you're dealing with the diagnosis and treatment and even beyond, often there are limitations. And so you really learn to manage as best you can. And you can, when you're kind of good days and feeling stronger, and we can ramp up programs, but there are times when we need to ramp them down. And whether that comes with intensity or the choice of activity that you're doing or the amount of time you dedicate to it, all of those things matter. But I'm always I'm a pretty optimistic being with exercise, that there's a way, like everybody can move. So let's together, let's solve this puzzle and let's get you moving. So, I keep it simple, getting started, keep it simple. One of our taglines is to avoid inactivity. Anything, if it's walking to the mailbox, just walking a block or two, taking your dog for a walk, all of these things count. And they all are, the simplest components of exercising. Oxygenate the body, move the blood, and keep the joints flexible. Try to maintain muscle mass. Talk with your doctor if you have concerns. Ask questions. Make sure that it's safe. Know your limitations. You're a big part of the equation with any exercise programming. So you ultimately need to know what you can or can't do as you consult with an exercise specialist. You consult with you go to take a class, a group class, or just making sure I see a few chats. So talk with your doctor if you have any concerns or questions, and make sure that you communicate and relay that to anyone you might start working with or any class you attend. Seeking expert support. It is a growing field, and more across this country and beyond, there are people who are getting certified to be cancer exercise specialists, and or, so that's personal trainers that are getting certifications to help cancer patients, group exercise instructors that are learning class formats. And then the higher level would be clinical exercise counselors, clinical exercise therapists, obviously physical therapy sometimes has its place in this as well. So seek advice from those who are certified and qualified to give good, safe advice on exercise. Build a plan. So I always talk to people, sometimes it helps. One, set your goals, make sure that you're tracking things, daily logs. You can do this with pen and paper. There are lots of now, apps that are on smartphones that can support this, or even just like a spreadsheet, whatever works for you. I think it's important to keep track of what you're doing and to sort of watch the success, as well as to, I talk about planning your exercise. So when you sit down to think about the week that's ahead, what days and when can I fit this in? And sometimes that's linked to, a class you may be attending. And these days it would be a virtual class. So you can obviously schedule that time and mark it, or, a walk you plan to take. Just making sure that you think about when you can fit it into your week, opposed to just letting the week get upon us and then, I should exercise. So I think that often helps with overall adherence. The next page, let's see if I go to the next one. So then I just wanted to kind of break it into categories. Aerobic activity and exercise. Always talk to people about this. The current recommendations, 3 to 5 days a week, starting up, we say 75 minutes a week, eventually building up to 150 minutes a week. And then if you're doing more vigorous exercise, we can reduce the minutes or amount of time. But you start where you are. You could start with a lighter, lower level, and the body does respond with dedication and with commitment. So you will ultimately sort of slowly build that. So in other words, it could be by pace or distance. Maybe yesterday you took a 10-minute walk, and that's what you're going to do this week, but the following week you're going to try to do a 12 or 15-minute walk. So there are lots of different ways to work on adherence and success progression with exercise programming, and it doesn't have to be terribly complicated. So aerobic activity, anything rhythmic and continuous. So, biking, walking, jogging, swimming, dancing, in the comfort of home, just turning on music and moving your body a little bit. Anything for 5 to 10 minutes. And then over time, you can slowly sort of build up and add on to that. Strength training. It's important to just maintain muscle mass. I often talk to people, maintain and or gain. But if you think about just maintaining function throughout your life, you want to have, our muscles support our bones. They support our joints. They help us just in general with activities of daily living. So, whatever that might be, getting groceries out of the car and into your home, putting them away, cleaning the house, all of these things require muscle support. So hand weights work. There are resistance bands you can get. You can just use your body weight. I tell people all you need is a little bit of space, and you need your body. And, you can sit on a chair and stand up and sit down 10 to 15 times. And that does work major muscle groups. You can use a wall, and you can do wall push-offs. And again, you're targeting large groups of muscles, and you're getting the muscles to contract and release. And that's, 2 to 3 days a week is the recommendation on that. You start with you start with lightweight. You start with, I typically tell people 8 to 10 repetitions. And then over time, you can slowly build up to, add an additional 2 pounds or 3 pounds, and you can increase your repetitions. I usually give guidance somewhere between 10 and 15 repetitions. And I suggest two sets of exercises with major muscle groups. And then, we talk sometimes about just other things. I like to talk to people about the importance of flexibility. So range of motion in your joints, move them. Just simple shoulders are major joints in our body. We use them all the time to push and pull things and to reach. So just going through some, simple flexibility, range of motion. There's one conversation around flexibility with dynamic versus static. And I think both are great. So static is when you just hold something for 10 to 20 or 30 seconds. And then dynamic is when you're adding more motion to it. So, if you're just like taking my arm, I reach up and over my head, 5 to 10 times. And if I were doing that statically, I would reach my arm up and hold that for 10 to 30 seconds. So some combination of flexibility and range of motion activities is typically good. It helps prevent injuries. And again, it just helps with overall function. Take more steps, you know, just again, if you start, and it might be the block in the beginning, but, you know, over time, if you continue to do that, you'll do a block and a half, or you'll do, you know, 2 blocks. And then, you know, before you know it, you might be walking a mile. And so, you know, the recommended goal just in general is 10,000 steps a day. We've learned something that we're putting in place with these current changes is, if you're undergoing treatment and struggling with fatigue and issues, to kind of, you can knock that back with 7,000 to 9,000, just sort of making that, and you can break it up. This doesn't all have to be done in one session. That's often something that people, I think, get intimidated by with exercise, is that you have to dedicate 1 hour or, you know, a chunk of time, and it sounds like too much, but the truth is, at the end of the day, if you do 15 minutes in the morning and 15 minutes in the evening, at the end of the day, you did 30 minutes of exercise, you add it all up, and it all counts. And then I like to talk to people about trying to find things that are pleasurable with movement. So again, if it's dancing in your kitchen to a favorite song, or if you really like Tai Chi, yoga, or if you have, you know, children or grandchildren, finding some activity to do with them. And just try to find something that's not like, oh, I have to go exercise again. You know, trying to weave fun in once in a while, I think, is very, very important. For me, I love taking my dogs to walk on the beach. I'm so happy when I'm there, and I know it's good for all of us. So, and then balance exercises are key. So in general, as we age, neural pathways start shutting down. So it's really important throughout our life to do things where we're targeting, doing things that challenge the body to balance better. So, you know, just even standing on one leg while you do a bicep curl, that's one way to balance, or just stepping from one foot to the other foot and holding for, 2 to 3 seconds on each foot. So you're transferring your body weight. There's so many, different ways to address balance. Lots of great resources, and I'll kind of close with this. And currently, it's been interesting, this shift with our current restrictions in place, just going online and finding things. I mean, you can Google, you can YouTube, you can, if you have smartphones, there's so many exercise programs and apps. Some are free, some are fee-based. Online with social media, there are a lot of resources out there. You can just do the Google search for cancer and exercise, programs. And I can speak more specifically to some of that if you have questions. But American College of Sports Medicine is a good resource. Cancer Exercise Training Institute is a good resource, and she has a pretty strong social media page with lots of links and supports to exercise programming. So I'll pass now, but I'll happy to answer any questions when we get to that point.
Margaret?
My name is Margaret Gray, and I am happy to be a part of a team from the Patient and Family Cancer Support Center. And our team consists of a great group of folks. We have Mary Destry, Paul Asfor, Michaela Berlich, and myself, Margaret Gray. And so just a little bit that I usually share with the Net Wellness patients. Basically, the Patient and Family Cancer Support Center, we're a great hub of resources and supportive services that are not traditionally medically supported, but things that will help you during treatment, during recovery, and beyond that. And that's why we're there. We can help not only you, but your family members, your caregivers. And we do that by helping you through various supportive services and empowering you to feel that you know where to go and how to get that type of support that you're needing. And so just a few things, as being a hub, we have, of course, as I mentioned, resources, and that will look something like, it could be a patient education sheet that you can find on our website. And if you're not familiar with our website, that is cancer.ucsf.edu/support/CRC. And on that website, if you haven't, it's a great place to be to gain a bunch of information. And those resources are not just for our patients, but also the supportive group things are open to anyone. We also have programs, wellness classes, and specific events, movement classes. We also have peer support, which is a great way to reconnect and find things that you can give back. And by doing so, talking to another person that's gone through a similar diagnosis or a treatment path. And so that's done by phone. So again, you can do something and be very supportive to someone else. We also have other things like online meditation and just a plethora of things that we can offer you. And we just want to let you know that the patient education resources, our events, Mary Destry has put a lot of time into getting things up and going via Zoom, such as this, support groups, and we're a liaison to many of the ones that's spoken already, nutrition, exercise, also with the social workers, and just making sure that you know how to get in connection with those resources that you're needing. There's symptom management. Some people don't know much about that. And for those who are artsy, we're trying to get things ramped up again in that area as far as art for recovery. So again, the list goes on, and just wanted to let you know that we're there for you. When you go to our upcoming events page, you'll see currently, as we know, we're right here in our Neuroendocrine tumor support group. That's the first thing that you'll see. And the next one is coming up is healing with writing. And also we have restorative movement. So those are our movement classes. So it's a little bit of everything, something for everyone. And we invite you when you come to your appointments. We're right there on the main floor. And as soon as you see the information desk and the great gift shop right there, or right to the left, come on in, and we're there to help you as much as we can. Thank you so much.
So my name is Lacey Fetting. Thank you, Margaret. And I'm a UCSF clinical social worker. I specialize in oncology. So I'm really proud to be part of this multidisciplinary net wellness clinic each and every month. And I'm very grateful for the opportunity with you today about this clinic. When I meet the clinic participants, I begin by describing my role on the UCSF Net Wellness team as a licensed clinical social worker. And many participants have not ever met with a social worker. So I provide information on my background and specialty of oncology social work. I ask if people are interested in a description of the kinds of services I can provide. In other words, I give them the menu. And I'd like to review that with you as well today. So let's start with practical matters. Transportation, lodging. An example, people come from all over for PRRT. I help them think through their own resources and plans to get here, and provide information about available lodging if needed, including the information that UCSF has some hotel rates they could avail themselves of. Transportation plans can run the gamut, from knowing what's available in your community, like paratransit, to knowing if there's help if you come from far away. Often people say, are there any available financial assistance programs, open grants? This can be limited, of course. Well before COVID, resources and funding for help is based on funding streams that change and quickly. So part of social workers' role is to include letting you know not only what's, but also problem solving with you when community resources fall way short. I promise my effort and not a specific outcome. So practical supports, can also include pretty simple things. For example, people say, you know, getting in and out of the car when I get to treatment is really getting problemsome. It's really So social workers can help those who are eligible to complete the required forms for disabled person parking placards from DMV. And we facilitate the signatures that you need from your UCSF providers. I help people consider the costs of cancer, often as they consider the question of to work or not to work. When you're able to work, information and resources with guidelines for communication with your employer, helping people complete job protection or FMLA paperwork with the support of the UCSF healthcare providers, information and guidelines to consider what could be called a reasonable accommodation to continue to work. When you're not able to work, guidance and go-to resources to help patients and families appreciate eligibility requirements for job protection, again, and income replacement programs, such as disability, whether it's employer-based, state, or federal, and where to even start. Getting to know the timelines and sequence of these programs can go a long way to help mitigate the distress one might feel when trying to sort out, hey, just what income might be available. Advance communicating with the healthcare team, navigating the healthcare system, like in-home supports or caregiving agencies, whether it's home health, palliative, or hospice care. What's covered and what will be out of pocket. We've been talking about managing the costs of care and problem solving, and social workers obviously can't complete every form for a person, but we can help in this way. We can help break down preparing to work or not to work with your treatment and wellness plan into more manageable tasks to help you break down the tasks for your particular plan. So we provide information about community support programs, including all the programs that Margaret described, and I have referred many people to NorCal CarciNET. Throughout the practical supports, social workers provide short-term counseling. There's a lot of worry in navigating the details inherent in the practical matters we're discussing. Short-term counseling for adjustment to diagnosis, managing treatment, anxiety about scans, managing work, school, and life in the community. Tips on talking to your children and your grandchildren. Coping with the certainty of uncertainty. Coping with grief. Techniques to help one tolerate distress. Caregiver supports. Indeed, social workers wear a lot of hats. The profession of social work has a charge. Reagan mentioned it earlier. Much like physicians have an oath to do no harm, social workers try to always start where the person is. So this guiding informs my approach. After I identify the available services, it's the clinic participants who choose the problems to be solved, the services they hope will help. I start our collaboration on their terms. So I may overwhelm some with the menu I just described and comfort others. Some may turn around and say, I just need to know where to pay for the parking. But this menu may help you for the future. It's kind of like a guidebook that you take off the shelf and you look it over. And as you put it back on the shelf, you say, see you later. But you know it's there. I'd like to provide a case example in the way of a composite case, a couple. Jane Doe and John Doe aren't real people, but their situation is realistic. And this is the kind of problem solving I have had with patients. Jane is 62, and she had recently started a second career. She loves her job, and she wants to continue to work as long as she can. Jane was diagnosed with a neuroendocrine tumor, and her treatment plan will be intense. She will not be able to work. She may lose insurance when she stops working. Her husband is 66, and John's been considering retiring from his job of 34 years, particularly if Jane continues to work. He'd even started to look at the Medicare supplemental plans. Now Jane and John are worried about her impending, perhaps loss of health insurance, and they are overwhelmed. Their goals are clear: to prioritize and support her care and to try to be financially smart about it. What are their options? Well, social workers can help by being a sounding board for practical and financial concerns so that people can say out loud to someone the pros and cons for the plans they are considering. Social workers have the knowledge and resources, as well as the paths that others have taken inside their heads. So John and Jane came up with their plan. John didn't retire. He continued to work, and Jane went out on disability, and John would add her onto his insurance, his work insurance, when needed. To quote The Wire, they wanted it one way, but it was the other way. But they felt confident that they had thought it through. Finally, social workers want to be helpers. Roger says that when there's trouble, tell kids to look for the helpers. And I'd like to acknowledge right now how much patients and families help me. And most importantly, how patients and families can help each other, as you all do right now as members of NorCal CarciNET in this support group, particularly with Josh at the helm. So kudos to you all and thank you. Josh, you there?
Yeah, Angela, do you want to start answering some of the questions you had from previous, either from earlier today?
Yeah, so first of all, I just also wanted to clarify the role of the Neuroendocrine Wellness Clinic. It is a consult clinic, so patients come once. They continue to stay with their healthcare provider, in general, Dr. Bergson or one of the other medical oncologists at UCSF. And if they have needs that they have identified that need to be met, for example, as Lacey was saying, she starts working with one of the patients, they can then follow up with Lacey independently. And so the patients can follow up independently with any of the providers in the Neuroendocrine Wellness Clinic, but they continue to see their medical oncologist as well. So I just wanted to clarify that. Additionally, there was a poll that Josh sent out yesterday or over the previous days. And it looked as though, I just wanted to address some of the concerns. One of the questions was about patients getting access to care. And that would be medical advice, to scans, to injections. And so as far as UCSF goes, and I'm aware that not everyone on this call is a UCSF patient, but as far as UCSF goes, we are behind the scenes business as usual. We are seeing all of our patients via telemedicine, and that probably will go on for a few more months, I would say, as shelter-in-place restrictions start to get lifted. I think we will continue to do telemedicine visits. Additionally, we are still doing neuroendocrine tumor board twice a month. So if there's any cases that need discussing, we are still doing that. And patients should still be getting access to their treatments, Sandostatin or lanreotide. As of now, there are no cases of COVID-19 at Mission Bay. There are some children admitted to the Children's Hospital with COVID and up at Parnassus, but not at Mission Bay. So it is safe to come and have your injections at the infusion center. However, if you would prefer, Ipsen and Novartis both have services that will provide someone to come out to your home and give you your injection. So that is a service available to you. Josh knows the resources on that, so you could reach out to him if that is something of interest to you. And as far as scans go, we are well aware of the anxiety that having a scan can cause and not having a scan can cause. And it's really in our mind about the risks and benefits of having people come to UCSF, to a facility, when we know that COVID is such an infectious disease. So given that our numbers of COVID in San Francisco and the Bay Area we've been very fortunate. UCSF is going to be loosening their restrictions on non-urgent scans. So as of June, we will be doing more scans to evaluate how your tumor is responding to treatment. But we do appreciate that this is a very anxiety-provoking time for everybody. I also want to just acknowledge that, you know, I personally am getting a taste of what a lot of you live with every day, and that's living with uncertainty. And I know that that can be extremely difficult to live with, and I really appreciate your courage and strength in living from scan to scan, from appointment to appointment, and living with the uncertainty of what life is going to give to us and bring to us. So I just wanted to acknowledge that. I think that we had some questions. There was certainly a question about carcinoid syndrome and nutrition, which I probably will pass over to Greta. Someone was interested in nutritional tips for nausea and no appetite, additionally to malabsorption, digestive irregularities, and diarrhea, which is a huge topic to cover, but maybe just very briefly, Greta, how would you approach some of those issues?
Sure, sounds good. That could be a long topic, but I think, so for carcinoid syndrome, you know, it does affect a small group of our neuroendocrine tumor patients, but for the people that have it, nutrition can be a big factor, because with carcinoid syndrome, you know, definitely the symptoms of flushing and diarrhea can potentially be managed partially by diet changes. It's pretty individualized as far as what you're going to respond to. Generally, I always recommend, you know, eating smaller meals because large meals might trigger symptoms. Avoiding really greasy, fried, fatty foods. Those can tend to be common triggers. And then we have a whole set of other foods that are high in something called amines, which are basically byproducts of aging foods. And for some people, those can trigger symptoms, but it's pretty individualized. So if you go to our nutrition links on the neuroendocrine website, UCSF neuroendocrine website, I do have a handout on there that addresses carcinoid syndrome and gives some general diet tips, and then goes into, you know, my biggest goal is for people to keep a food record for a couple of weeks so that they can try to dial in what might be triggers for them specifically, as opposed to just having blanket diet recommendations of just avoid these certain foods, because I like to have like less restrictions if possible so that people can figure out what really might be a problem for them versus just avoiding, you know, a lot of foods that you might enjoy or that might be nutritious. So to talk a little bit about the diarrhea and malabsorption, malabsorption can happen for a lot of reasons for people with NETs. It could be related to previous surgery. It could be related to if you're on a somatostatin analog for a long term, potentially you could develop some pancreatic insufficiency to where you're not digesting your food properly. So there's a lot of different workup that would go into us helping you manage diarrhea, but in general, people do better by avoiding, you know, fatty, greasy foods. You'll probably hear me say avoid fatty, greasy foods for most of these tips. Eating, again, smaller meals, and maybe shifting some of the types of foods you eat. So some people are going to be really triggered by raw vegetables and maybe then moving towards cooked vegetables. Some people might be more triggered by dairy products, and so we might be shifting away from those. But at the end of the day, we want to make sure sure that if you are having malabsorption, that we're trying to address it and trying to look at what nutritional issues you might be developing as far as deficiencies, and making sure that you're supplementing so that that doesn't become an issue for you. And that you're just able to absorb so that you can feel like you get energy when you know, throughout the day, and that you're not getting dehydrated and things like that. Lastly, for nausea and poor appetite, I think people tend to do really well with eating just smaller amounts more frequently throughout the day. So not really stressing out on how much you have to eat when you eat, but just kind of thinking about grazing so that every couple hours you have an opportunity to get some nutrition in, and kind of focusing on more nutrient dense food. So that way you get more bang for your buck when you eat. So for example, eating plain pretzels, well, they might help settle your stomach so you can eat, you know, a more balanced meal after that. But if that's your snack, that's going to be not a really great source of nutrition. So we may want to look for something that's going to give you a little bit more bang for your buck, maybe a smoothie, or maybe, you know, just looking for a soup that's really nutritious. So again, I have quite a few resources on our website, since we can't delve too far into it today.
Great, thank you, Greta. On the poll, on the survey that Josh had sent out, there was, the first question, I believe, was about sleeping, and 39% of patients or respondents had said that their sleep had been disrupted. And then question 4 was exercise habits, and 39% of patients said they're exercising less. So I just wanted to address that. Sleep is, I think it is well sort of understood that sleeping and sleep patterns have been affected by what we're going through. And there's a tendency for us to be on screens a lot. So I just wanted to review sleep hygiene briefly, which would include going to bed at the same time every day, getting up at the same time every day, at least an hour before bed, no screens at all, and have some lovely nighttime ritual, either having a bath or sitting reading with some dim lighting, or something that you do every evening that tells your body, oh, it is time for me to go to bed. When you go to bed to sleep. Don't do anything else. You're not watching TV, you're not reading. Your body gets used to the fact that when your head hits the pillow, you are meant to sleep. There is a lot of sleep hygiene recommendations that we can provide for you as well. But one of the important things that I notice is that people are exercising less, and we really need to exercise in order to get good sleep. So Reagan, I'm wondering if you have any input into exercising in the COVID-19 era from a safety point of view, and maybe things that you could do at home, and versus aerobic versus non-aerobic exercises.
Yes, I think, you know, I know it's certainly has been challenging, but I have to tell you, I've seen this whole, you know, movement of people in the health and fitness industry really jumping behind this and, you know, taking advantage of virtual platforms. So again, you know, there's so many different ways. It kind of just depends on what you pre-existing and or you know what you have access to, but it also can be really, really simple, you know. So it could be to set up, you know, a phone consult with myself or Jane Clark and let us just, you know, talk to you quickly to get a sense of you know what's going on and why you're not exercising. But you know, there are so many again, smartphone apps that are either fee-based or some of them that are free that have good tips, and they run the gamut from, you know, I want to do 10 minutes of exercise to, you know, you can find things for strength training, or you can find things for yoga. I mean, this is the same on YouTube. There are thousands of videos on YouTube. I'll send some links to a couple of resources on social media groups as well. I mentioned earlier Cancer Exercise Training Institute. That's Andrea Leonard. She's doing stuff all over the country with cancer exercise specialists, and they're putting up videos frequently. Also, Maple Tree Cancer Alliance, the trainers from that group, they're on the East Coast, but they're actually doing live videos, working with patients and putting them on their Facebook page. And I mean, typically they're 10 to 20 minutes, and you can follow along. A lot of health clubs or smaller boutique, studios, yoga, Pilates, dance studios have gone to virtual platforms. So if you were connected to a health club and or you had a yoga class that you like to go to before COVID-19, I'd suggest that if you haven't already done it, look them up and see what they're offering. A lot of places are offering services free. Some of them are, you do like a monthly fee, so you have access to online videos. Again, you can consult with a specialist and get a program designed that is, simply with whatever you have. If you have dumbbells, and we can talk to you about, how to do a little bit of cardio and then do some things to maintain muscle mass. It really is, if you have your body and you have a little bit of space, we can come up with something. And another thing that I've said to people is, just especially in shelter in place as we are in the Bay Area and all, the surrounding counties, break your day into, it's like a start of day, first half day, second half of day, and maybe just think, okay, at some point between, whatever, 8 a.m. and noon, I'm going to move my body for 20 to 30 minutes and do it. If you find a 20-minute video that's stretching and yoga, great. If you find, if you feel like you want to do core work today, I promise you it's out there. So, you can find things to guide you. And again, there are so many tools accessible, and it really just depends on, how you like to do it, what you're looking for. But, I think that kind of covers it. There's so you really have, the platform was already quite large, but because of COVID-19, it has just grown tremendously.
Right. And then also just to put out there, from a healthcare provider perspective, it is okay to go for a walk. Put on a mask, stay your 6 feet away from other people, maybe choose to go when you know that it's not going to be really peak time, and go for a walk. Walking is great. And then when you get inside, wash your hands. But otherwise, it is safe for you to go out and go for a walk. So I really encourage you to do that.
Oh yeah, I absolutely agree. Get outdoors, it's
good for the mental health as well.
Right. Just be conscious of the spacing, but it's easy to do. We do it every day. Our family's doing it daily, and it is, it's nice. It's refreshing,
Yeah. Yeah. Great.